Thanks, Acting Premier. Good morning, everyone. Certainly we're making progress. This is another step forward for regional Victoria and Metro Melbourne. As we flagged last week, there was an expectation that Metro Melbourne could, by and large, go to the regional Victorian settings, and that's what's happened here. We do have to bear in mind that the risk is greater in metropolitan Melbourne. That's where our cases are. That's overwhelmingly where our primary close contacts have been, and that's where transmission is still occurring. But metropolitan Melbourne can go to those regional settings by and large, and regional Victoria can go to more liberal settings as well. That's all in recognition of the fact that there hasn't been transmission in regional Victoria, but we are opening up the state and there will be people travelling from Metro Melbourne, as you'd expect, into regional Victoria. So we still need some of those constraints in terms of the size of gatherings in various settings, in various locations, to be able to manage the risk should a case occur there. We do know that we're still getting cases. They have been linked most recently, and some of the cases that were initially unlinked over the last week or so, really we've got a pretty good idea of their connection to existing cases. But if I reflect on the Reservoir household, the Queensland couple, and even the case in Kings Park, who was neighbouring to a case but didn't know that, we've got individuals who are not aware that they were primary close contacts or secondary close contacts, who've done the right thing, had symptoms, gotten tested and isolated, and we've been able to link them back again, but they didn't know that they were cases. And so we have to work on the basis that we may yet still have cases in Metro Melbourne and potentially elsewhere who are infectious, who don't know that they're cases and who move about. And so these restrictions are a reflection of being able to manage that risk of transmission. The snapback to COVID normal, if you like, that we've had previously, we're not at that stage yet. We're moving by safe and steady increments with a view to continue to ease restrictions as we go along, as we run down these last few cases. But bearing in mind that there may well be cases out in the community, we still need to push that message that anyone who's symptomatic at any time, including if you've been tested maybe a couple of weeks earlier, to still get tested again to make sure that we find every single case that's down there. Those cases that have been found in the last week or two are by virtue of people testing because they're symptomatic. That's a really, really key proposition that we need to continue to prosecute. But I'll hand over to Jerome and happy to answer questions.
Outdoor, non-seated outdoor venues can have up to 1,000 people, but there's no spectators allowed for community sport in Melbourne. How does that add up?
So, you know, all of this recognises that regional Victoria is in a better position, relatively speaking, to Metro Melbourne. Regional Victoria has not had cases in recent weeks, for some areas for months. Metro Melbourne has had cases today and really most days in the last few weeks, with new exposure sites being generated, with new cases coming forward who were not aware that they were cases, who were infectious out in the community. Having a large gathering with strangers coming together poses a risk, while that is still the epidemiological situation in Metro Melbourne.
But I'm talking about this is Melbourne. You're allowing outdoor venues of no more than 1,000 per space, but no spectators at community sport. I mean, you're not going to have more than 200 people at some community sports games.
We are trying to allow community sport to go ahead with the minimum number of people attending as possible. So the sport can go ahead for all of the benefits of sport, but to have a discretionary element of spectators is not the point that we're at in Metro Melbourne now with the current epidemiology, and why, for all the reasons I've just said.
And why the special rules for COVID testing to go to the ski fields? And how far, is it just the mountains or is it communities like Bright around it?
It'll all be in comms when it comes into effect, and we'll clarify that, but it is defined to those alpine resort regions, and it does relate to the fact that the industry has to be protected. We need to make sure that there are no cases that go up on the mountain, even though the number in Metro Melbourne may well be tiny. A single case who's infectious up on the mountain would be a potential super spreading event. It's essentially how it spread across Europe in March of last year. It has been demonstrated in resorts, Whistler, Aspen, other West Coast Canadian towns where significant clusters have occurred because of all of those combinations that I've talked about so many times: indoors, post-exertion, no mask wearing, with strangers, and that combination of cold and humidity that all come together to make it a higher risk environment. So it's a small thing to help manage that significant risk.
When can we get football back at the MCG and Marvel, and with crowds?
As soon as possible is the short answer. As soon as possible. I still don't know what tomorrow will bring, what the next day will bring. We are clearly looking to make changes on a week-by-week basis. We will look to the end of next week for those very reasons. And the fact that footy's going ahead in Geelong is a sign that we can move to exactly those kind of settings down the track.
So we could be without football in Melbourne the weekend after next.
I'm hoping that we can get footy back to Melbourne as soon as possible. I don't want it to be deferred any longer than it has to be, but I don't want us to be in a situation again where there might be cases in the community going to the football with this Kappa variant or Delta variant in particular. The Kings Park transmission is a demonstration again of people who haven't had face-to-face contacts, people who don't live together, work together, who haven't been in a restaurant together. We're talking about people who maybe have passed each other in a shared corridor, or who maybe have walked through the same space at different times with the virus just sitting around as an airborne fog. That's the challenge, and I don't want that to be spread through a sporting event. So we just need to see how this week pans out.
Just one other one while I've got you. If you're for the school holidays coming up and you're flying interstate, particularly to Queensland, what's the situation there?
So just follow the rules of those jurisdictions. If there's no constraint, you're obviously allowed to go to all of those jurisdictions, but you need to look at what their rules are for people coming from the whole of Victoria, or indeed some of them just have Metro Melbourne as a hotspot effectively.
And on those ski fields, what kind of documentation do you need to prove that negative test? Is that a piece of paper or a text?
We think it's just the SMS message on your phone to show as proof. We want to make it as simple as possible.
Did you consider making it a wider requirement for anyone making an overnight trip to the regions?
No, I don't think so. I think we're talking about settings in the regions that will manage that risk. It's not that ski fields are the only place where transmission can occur, but we want that extra level of precaution for those settings.
It's really hard for them to be kind of on tenterhooks for this weekly announcement that we've got going on at the moment. Why not come up with some kind of roadmap or plan similar to what we had at the end of the second wave last year, so they can at least plan for density limits, reopening, things like that?
Look, I think last year was extremely precautionary. We were coming out of a really huge second wave, and we looked at days and days of zeros or days and days without mystery cases before we changed. If we were going along such a conservative path, you could lay that out. We are trying to go back on a day-by-day assessment so that we can go back to eased settings as soon as possible. That's what makes it a day-by-day prospect for assessments, and we're still trying to flag those aspirations for week-by-week changes, and with an expectation, and I think a pretty strong expectation, that there'll be another level of easing at the end of this forward week.
When do you think we might be able to get back to what we were before this outbreak? Do you think, especially considering it's winter and people are mixing inside more, is that going to push it back even further, do you think?
I don't know that it does push it back further. I know that we need some days where we're really assured that our last cases are wrapped up, that there aren't new community exposures that are occurring. Winter will remain a high-risk period while we've got 3.5% of Victorians fully vaccinated or thereabouts. We need everyone to be vaccinated before we can really manage that winter risk. But all of those other things that we're talking about, checking in with your QR code, getting tested at the first signs or symptoms, and other COVID-safe behaviours are really critical right through this period, because we know people huddle indoors, we know people will have coughs and colds and might dismiss it. So we do need to just bear in mind that the risk will be quite high through the winter period until we can get high vaccination coverage.
Does that mean we're not going to be able to get back to those previous settings? Are you saying
No,
we
I'm
need,
not.
we need several 0 days in a row?
No, I'm not. I'm just saying that there's going to be a heightened risk of transmission right through winter. That doesn't mean that we can't go back to settings that we'll all enjoy, but it does mean that we're going through a period of greater risk, even as people are getting vaccinated, than over a summer period where people spend a lot of time outdoors.
Weddings can have 20 people but no dance floors, but funerals can have almost 4 times the number of people. Why is there a big difference between those two?
Look, I've spoken to it before. Funerals need to take place on fixed dates or relatively fixed dates. Weddings are very important occasions for people. I understand how disruptive it is to have a limitation on numbers for such an important occasion, but they can be deferred for some people. I know that there are bookings made, there are arrangements made, there's lots of planning that goes into them, but they're not the same as funerals in that regard. And I do expect that in the same way that the caps for weddings have changed with the public gathering limit, that they'll continue to change with the public gathering limit as we go forward. And so deferring to another week or fortnight ahead is an opportunity to have, potentially significantly more people there.
Are they higher risk weddings?
They are higher risk. We've seen outbreaks both through last year in Victoria with weddings, but there's international experience that absolutely supports that. People try and do the right thing, but of course there are strong obligations for people to attend weddings. People might minimise their symptoms because of that. And of course, hugging and kissing is normal practice in weddings. As much as you might say wear a mask at all times indoors, we know that people are going to be in close contact because of the nature of that event.
Do you have any data to suggest how many cases may have been prevented in the past week due to wearing outdoor masks?
No, it's really difficult for each individual intervention to know what a difference it makes. I do know that we're still seeing transmission in circumstances where you would expect that wearing a mask could make a difference. It is, it has been pointed out that fleeting contact has been a feature. How much that compares to other variants, we haven't got all of the data, but we keep seeing it. And if wearing a mask makes a difference between walking past someone and not picking up that virus and therefore being out in the community unaware of your status as a case, or completely protecting yourself, that's a useful thing.
So
we will continue to recommend masks when you can't physically distance.
So are you saying that fleeting risk is lower this week than it was last week?
I think the risk is going down by increments week by week. We are running down these last cases. They are linked. We have linked previous cases. We're not seeing cases of unknown acquisition that we can't find any source for. So by increments, the risk is going down for sure.
How strong is your belief that there are cases out there that we haven't picked up yet? Jerome's touched on it recently, and how has that impacted?
It is hard to know. We've got reasonable testing numbers. I wish it were in the 30,000 mark, 40,000 mark still. I know that people in Port Melbourne, South Melbourne, Melbourne Central will pick up with testing today. That's a good thing. I know that people will look at those exposure sites that are especially focused around Port Melbourne and South Melbourne and will come forward for testing. But we want broad testing because you could still be in a suburb where you look at active cases near you, you think there's no risk, and you therefore don't get tested. So there is absolutely a possibility of cases still being out there undetected. We've seen that just in recent couple of weeks.
Is it concerning to you that a nurse has tested positive despite receiving a dose of the vaccine, or are we going to see this as we get more vaccinated?
We will see it from time to time. The vaccine provides protection. It's an absolute must. It's a must for healthcare workers, but it is not a perfect solution for protecting oneself. And so that Tier 3 PPE is still a recommendation for Melbourne and Victoria right through this period. So the N95 masks are that additional protection, but vaccination is something that's going to protect healthcare workers and everyone. In addition, it is not a perfect protection. However.
Do you know if they're asymptomatic or?
No, the nurse did develop symptoms, and so that was you know, that was a good indicator of when the infectious period, being 48 hours prior to that, is likely to have started.
How frequently are staff being tested in that ward?
I don't know. We'll you know, get details through the investigation. It was only midnight that the case came through for us.
And was this nurse treating any non-COVID patients?
That's right.
So was she treating any non-COVID
Oh,
patients?
no, as far as I understand, in Epping Private, she was on the COVID ward.
Given winter is a lot more high risk and our second wave was during winter last year, do you think we might be able to see masks indoors for the whole season?
Look, I think we'll think it through, depending on how cases go. But we want to maintain, you know, people being engaged in those behaviours. We don't want to fatigue people. If it's a case of some specific high risk settings, of course we've kept that in mind. That's been our advice on public transport, airports, and rideshare right through. But we don't want people to be fatigued by mask wearing and basically not doing it and seeing others not doing it. So we have to balance those things.
Will you be attending PAYAC on Friday?
No, I'm not attending PAYAC. I believe it's a budget PAYAC, so it's not for me as far as I understand.
On gyms, can you provide a little bit of clarity around gyms? Is it 50 or 10 people who are allowed indoors?
What?
And some gym owners are just saying, can they have 50 people indoors at a gym? Have they understood the rules correctly, or is it?
It's a DQ4 setting for gyms in regional Victoria, as I understand it.
What about City?
DQ4 setting as well.
It says maximum indoors 50, but maximum group size 10 people.
So group size is a booking size for an exercise class, for example. So that's not a venue limit or a setting limit. That's a group booking limit.
Sorry, just one for Victoria, if that's all right, just quickly. What's the health advice behind the decision to open with no outdoor venue limit amusement parks in Melbourne, but there's no spectators at stadiums for footy matches?
So that there's still a limit for the venue for outdoor amusement parks. Outdoor sporting events are different, you know, with a significant number of people gathering. There's going to be a limit to those amusement parks, which manages that risk.
Is it more COVID safe, an amusement park?
An outdoor setting within an amusement park is more COVID safe than indoor settings, but
than a stadium?
No, not than a stadium per se, but you know, people are not going to go to a stadium with 50 people or 75 people for a big match. We want to get to a point where we can make a recommendation around proper crowds for those events.
So what would be the baseline of crowds that you think would be the next step to allow?
Well, the Geelong proposal for this Friday is at 20%, so there'll be 7,000 people there. You know, we'll work by increments for venues in the city in the same way.
And just quickly, Brett, did you push for a third week of hard lockdown last week? Was that something you were hoping to get over the line?
No, look, everything that we've done has been on my team's advice and my advice. So what you see is what you get. The settings that we've gone to has been the advice from me and my team.
And you feel comfortable with the relaxation that we're going to now?
Yeah, look, I want to re-emphasise to people that it ain't over yet, by no means. So, you know, please don't go back to behaviours that you know, would suggest that there's absolutely no risk. The new exposure sites today are a reminder for everyone who's been around South Melbourne Market and other exposure sites in that area that these exposures can pop up, and so we need to remain vigilant, including for mask wearing at the moment.
Are you concerned that compliance levels are dropping, and even in this past lockdown, are you concerned that people have been flouting the rules more so than other lockdowns?
It's tough. It's really tough. This is 16 months into a pandemic. There's no question that people are over this, and you know, how do you maintain such behaviours over 16 months? It's a huge challenge. That said, Victorians have done it so fantastically. You know, the testing rates, even though they're in the 15,000, 20,000 mark, have still been higher than so many other places, and on a per capita basis has been fantastic. That's still turning up cases for us that allow us to manage it. So, you know, my congratulations for Victorians, but yeah, enormous sympathy for all of us around how long we've had to put up with this awful virus.
Does that suggest that we need to ditch lockdowns for good and learn to live with this in our community?
Look, learn to live with this virus has been interpreted in different ways. If learn to live with it means that we just have normal settings and we don't worry about how we manage an epidemic increase in cases, we will see tens of thousands, hundreds of thousands. Even with 60+% of people in the UK with one vaccine, you know, they're looking at 10,000 cases now. They're wondering if they're going into a third wave with up to the 60,000 cases per day that they had in their second wave. So we can manage this down to zero, and I think we absolutely should, because that will give us the assurance that we can actually ease our way of living in a way that gives us confidence of being safe.
What do you make of cities like New York and LA opening up, getting rid of restrictions despite not being at 70 or 80% vaccinated?
Oh, they're very close. I mean, they have driven their numbers down. They've driven their deaths down very, very substantially. Of course, the United States has had over 500,000 deaths. It's a public health tragedy through the last 16 months. But when you look at cities like San Francisco that have got some of the highest city levels of vaccination coverage, restrictions are off effectively. People are living normal lives and they are not having their health system overwhelmed. We should look to the effects of that high vaccination coverage as something that we need to get to, and the sooner the better, obviously.
Speaking of vaccinations, a lot of multicultural communities over 50, we've noted, are very sceptical about the second jab, and we're trying to access them. But is there any program you've got in place other than engagement, to particularly in the aged care setting where we ravaged last year?
Yeah, we do. We continue to have online and other engagement with multicultural communities. The second jab does provide a really additional level of protection, so it is an important one to follow up with. For AstraZeneca, 12 weeks later, it'll give you that longer term protection as well as that higher level of protection.
Talking more about the fear they have. I mean, I don't dispute the jab. I'm saying our communities are scared of this.
I mean, we have to address people's concerns on a case by case basis. People come at with their doubts through various motivations. Some have seen online misinformation and disinformation. Some of it will relate to absolute fantasy. Some of it will be a kind of twist on a genuine concern around clots, for example. We need to address each and every one of those with an understanding of where those concerns are coming from. It is not simply a case of providing information. We know that that's not the whole story in engagement on vaccine hesitancy. You need that nuanced, repetitive and deeply engaged process so that we can address people's concerns properly.
People who go to the snow before they've got a test before they go to the snow, what happens then? Do they have to isolate until?
No, we're essentially asking people without symptoms to get a test, or everyone who's attending alpine resorts to get a test. They can head off, but they need that negative result before they can enter.
Sorry, just one more on vaccinations. Are you disappointed that the federal government hasn't come out and given a plan or a roadmap of where we'll be in a couple months' time when more people are vaccinated?
Oh, look, I empathise with the supply constraints globally with this vaccine. It is entirely a matter for the federal government as to how they map out vaccine coverage, but there are genuine supply constraints, and in a rather volatile global situation where everyone wants those vaccines. So, to the extent that that supply certainty can come about, that'll be great. But as I understand it, Victoria, as for some other places, has greater demand than supply, and so that is a genuine constraint. I wish it weren't the case, but it is. But everyone wants us to get to a place where we can have high vaccine coverage and lead our lives differently.
Mr. Molino, can I ask you a question? What's the reaction from...
Professor, just on a bit of a lighter note, once we're out of this, what are some of the things that you're most looking forward to doing? Are you looking forward to going to the footy again? What's on your list to do once we're out of this?
Probably seeing friends and family interstate, having time not working would be my two priorities. I've got lots of family overseas as well, so if we're looking to the medium and longer term, I, like so many Australians, desperate to see some, close family who are the other side of the world. So, so many of us have similar aspirations through such tough times.
Something that lots of people talk about during these outbreaks, and it's something that's been mentioned by the crossbenchers as they negotiate these laws to replace the state of emergency as well, is kind of setting up thresholds or a traffic light system to kind of say when we get to this condition then these restrictions come in. How feasible do you think that is, considering how much of a changing feast every outbreak is?
Yeah, I don't know. I think, that it's a really complex issue around having some kind of fixed threshold. The circumstances change every single day, and there's a multiplicity of inputs and considerations that need to be made to make sure that you're acting in an appropriately precautionary but proportionate way as well. Those principles are embedded in the Public Health and Wellbeing Act, but it doesn't lay out the specific details of you will act at X or Y, because I think that's almost impossible to do. But obviously, very happy to go back and forth with the public health advice on what's feasible or reasonable, or what our perspectives are as that legislation gets discussed and drafted.
And just one specifically on the rules. If you're from Melbourne and you go into regional Victoria for a holiday, are you bound to the Melbourne rules, so you have 2 people with you, or can you have 5 people?
No, it's the venue and where you are. So regional Victoria settings are the settings that apply in that regard. So if you're booking your holiday and you're the household that's now in regional Victoria, then 5 adults and their dependents can join you in that accommodation.
Is that the same with weddings? So if a Melburnian gets married in regional Victoria?
Yeah, so it is where that wedding takes place as to what the caps are. Thank you.
Thanks.
Thanks,
Thank
everyone.
you.